Roundtable is an event which is organized by Europso as dedicated to the young people for the member association of Europso.
We celebrate the Youth Roundtable in Europso because we have identified special needs for these people in this special age. From 18 until 30, we must support to the patients in this moment of their lives.
The first one was very successful. It was organized in Zagreb in October 2030, and for this reason today we are here in Barcelona with 9 different countries, that mean about 30-40 different participants.
Europso is a strong voice, the ambassador and negotiator for psoriasis and psoriatic arthritis patient associations in Europe. Our actions are directed especially to aware about the needs of the psoriasis and psoriatic arthritis patients and to improve the approach to the health authorities, to the healthcare providers, to the associations and all the society in general in Europe.
I think it is very important that young people with psoriasis gather together and get empowered with knowledge of their disease and the actions that they might take so that the patients with psoriasis are better treated, not just by dermatologists but by general providers of care, including of course nurses, general practitioners, even pediatricians, because the early diagnosis by pediatricians is very important so that these patients can be adequately treated from the start.
I think it's very important to work together between different specialties because this is the only way to make an early diagnosis and to start the treatment as soon as possible when the detection of the psoriatic arthritis is detected in a patient with psoriasis.
The young people who of course can share their experiences, their life with psoriasis, see the differences about the treatments in their countries, and of course is a place where they can learn and be better advocates of psoriasis in their country, in their associations.
I think the young people are the most active people in the society, and I think that the involvement of the young people in these organizations is important to other people in the society to understand diseases such as psoriasis and psoriatic arthritis.
The presence of patients with psoriasis is rosy because dermatologists in general and many physicians have gained a better knowledge and better treatments are also available so that we can nowadays provide almost complete blanching for most of the patient population.
Psoriatic arthritis is a chronic inflammatory disease. The patients suffer an important pain, and the most important problem is that they may have disabilities and deformities in the joints. So the early diagnosis is the most important feature in these patients.
The first tip for me is that you need time to manage the stress. You need to think, to feel and express your emotion, and you need to explain to close people that you need.
The psychological aspects of psoriasis are very important because on one hand psoriasis carries a significant psychological and sociological burden. So it's very good and very important for patients to be aware that the disease can be treated, that the disease the stigma associated with the disease should be minimized.
The second tip is that you need to take care of your self-esteem. You have a good qualities to improve and negative qualities to change. And it's very important to detect and don't feel passive about them.
So my suggestion to young people with psoriasis is that they must be proactive, they must communicate with each other and associate in order to partner with the stakeholders, with dermatologists, with nurses, with the pharma industry, so that we can provide a better care and a sustainable health system.
And the most important, ask for help if you need it. You are not alone.
The next step is for Europe, so we start with a youth camp. And the next step, we will see that we will make a camp in the same way for younger people, about 25 to 35, 40 years old. because this disease is not some disease for the older people, it is a disease for young and the middle-aged people.